gastric burning pain.
Epigastric, meaning upper middle abdomen, below the ribs.
Correct. Right there. But here's where it gets interesting, and it can be a clue. The pattern of the pain often differs between duodenal and gastric ulcers.
Oh, how so?
With a duodenal ulcer, the pain typically kicks in, say, 2 to 3 hours after you eat, when the stomach is emptied.
Okay.
And here's the really characteristic part. It's often relieved by eating again or by taking antacids.
Eating makes it better. That seems odd.
It does, but food can buffer the acid temporarily or close the pylorus, the valve leaving the stomach. Also, waking up with pain in the middle of the night. Very common with duodenal ulcers.
Wow. Okay, so what about gastric ulcers then? Opposite.
Pretty much the opposite, yeah. With a gastric ulcer, pain often gets worse when you eat.
Why?
Because eating stimulates your stomach to produce more acid to digest the food, and that acid then directly irritates the ulcer in the stomach lining.
Makes sense. Are there other symptoms besides the pain?
Sure, things like heartburn, bloating, maybe some nausea. They're less specific. Could be other things too, but they often accompany ulcers.
You mentioned weight changes earlier too.
Right. People with gastric ulcers might lose weight because eating hurts, so they avoid it. But someone with a duodenal ulcer might actually gain weight because they're eating frequently to relieve the pain.
Fascinating differences. Now, beyond these typical symptoms, you mentioned alarm symptoms. These sound serious.
They are. These are red flags. Signs of potential serious complications that need immediate medical attention. No waiting around.
Okay, what are they?
First, hematemesis. That's vomiting blood. It could be bright red blood, or it might look dark, like coffee grounds if the blood's been sitting in the stomach acid. Either way, it means upper GI bleeding.
Got it. Vomiting blood equals emergency. What else?
Melena. That's Melena. It refers to black, tarry, really foul-smelling stools.
Black stools.
Yeah, it's the appearance of digested blood in the stool. Again, sign of bleeding somewhere in the upper digestive tract. Needs checking out fast.
Okay. Bleeding signs? What else?
Sudden, really severe abdominal pain, often described as sharp, like a knife. If that happens, especially with a rigid, hard abdomen when someone touches it, that's a classic sign of perforation. The ulcer is eaten right through the wall. Contents are leaking into the abdomen. That's a surgical emergency.
Perforation. Wow.
Yeah.
Okay. Anything else?
Yes, one more main one. Early satiety. Feeling full after just a tiny amount of food, especially if it comes with persistent vomiting.
Feeling full quickly and vomiting.
That could point to gastric outlet obstruction. Basically, swelling or scarring from the ulcer is blocking food from leaving the stomach properly.